I was incredibly inspired by my dad's spirit during his cancer journey. But the truth is, he was getting me ready. Welcome to Spirit and Truth. So today I get to talk to Dr. Ed Garnes, and I am absolutely excited about this interview. While the focus has been on me and my whole prostate cancer journey, there's so much more when it comes to the treatment and just the journey itself. We haven't really gotten into the mental health aspects or the mental wellness, the mental journey of it all. And so I am honored to be able to talk to my friend Dr. Ed Garnes today, and go down that road. How you doing, brother?
Man, I'm doing good. I'm doing this today. It's a good day. You know what I like about you? Every time I see you, I have family reunion joy. And your presence is like a warm hug. You know what I'm saying? So I'm in there, man. Whenever I get a chance to be around you, man, you don't know how many times you lift my energy. Because being a therapist, our times are up and down sometimes with things that we have to experience. So it's always good to be in fellowship with you, my brother, and I'm looking forward to this talk. I was kind of excited, like when you lay out your outfit for school. I was excited. I was thinking about that all day. I was at lunch, like, oh, I got the 7:30 meeting.
Oh wow. Well, I actually wore my Cyrus Nelson t-shirt today.
Okay, all right.
Just in honor of the moment. Cyrus Nelson is a brilliant black artist here in Atlanta. And so shout out to Cyrus Nelson Art. Y'all look him up, go get his
Mhm.
stuff. Um, so let's just jump in,
Oh,
man. So you know that I started this journey early 22.
mhm.
And when I got my diagnosis, it was also right after my divorce.
Mhm.
And so needless to say, man, I was in a space.
Okay.
I was in a really I can't even say dark space. It didn't seem dark. It just seemed like a turbine engine, and I was just like going around and around and around, and I couldn't figure anything out. You know what I mean? Um, but I had to. I didn't have a whole lot of choice. It was like if I want to get well, if I want to get better, I'm gonna have to deal with this. And one of the first things I did was to reach out for help in the mental health capacity.
Okay.
And so I I want you, if you would, to kind of speak to um, just the importance of like having like when you get a diagnosis like that.
Hmm.
It doesn't even have to be, for me it was prostate cancer, but it could
Yeah.
be, it could be anything. And just speak to the importance of how or speak to how important that is. You know what I mean?
Yeah,
Um,
I think it's very important because whenever you help seeking is a skill. I think we first have to
mm,
level set that the ability to ask for help is a distinct skill. Sometimes in the black community, we have been taught be strong, keep it to yourself. You know what I'm saying? We can move mountains if we don't say nothing, but that's actually a detriment to our mental health. So I think it was important that you did number one help seek, but what you experienced was medical trauma, right? So
mm,
trauma at its core is just an emotional response to a life event or life circumstance. So whenever you have a medical trauma, which involves things outside of your control, seeking help in order to process this new information is important. Because one of the things that happens when you have the medical trauma that you had, you ain't gonna have coping skills for
mm,
something that is new. Right. So that
right.
struggle to figure it out can be aided by someone in the mental health world because we specialize in helping you figure it out, helping you develop coping strategies to process things. But I think one of the things that I saw in you was you telling your story was a way of you emotionally processing. And a lot of times in the black community, we are not taught emotional process. I don't know about you, but did you grow up with hi, here's the Black Man Handbook on Emotional Processing. This is how you're going to deal with things and, be in touch with yourself. We didn't get that handbook.
I,
So,
I think the phrase emotional processing is something that I just heard right now.
Okay.
actually. This is my first
So yeah,
yeah.
so in red Kool-Aid terms, you had an experience that you needed to process and walk yourself through. How is this impacting me on the emotional level, on the spiritual level? How has this affected the soul force that is Kipper Jones? You know what I'm saying? Especially with you being such a lively person, full of happiness, full of joy. Something like this can upset the core of your being, right?
Yeah.
So you needed a space to be able to talk to that. And how you helped me, I was having a very bad day working on my dissertation. And I think it was the interview that you did with Brother J. Ray and Sir Daniel. You don't know how I got my deliverance, how it felt like
Wow.
church, a counseling session, because even though my issue was totally different, hearing a resilient story did something for me at a time when I was down, because I was ready to quit.
Wow.
So that's the importance of healing, because only healed people can share stories. So, so that your story and your journey has been very healing to me, because it's a story of resilience. One of the psychological strengths in Black psychology that we have innate in our being is resiliency.
Hmm.
That's the bounce back. And so your bounce back inspired me.
Well, I'm beyond appreciative. I don't even know what to say, man. Thank you.
Mhm.
I I just felt for me, it was important to talk about it, to release it, to get it off of me, so to speak. I think that
Yeah.
once we put the words out, then it no longer has you bound, has you confined. And so I know one of the things that early on in the journey, I told Johnny, I said, I've never said that I have this. What
Mhm.
I always said was my prostate has cancer. I have to deal with that, from
That's a
that
great affirmation.
perspective. Yeah, I just I said that to my urologist when she gave me the diagnosis.
Mhm.
And I said, well, so you telling me that my prostate has cancer? And she said, well, that's one way to look at it. And I said, well, darling, that's the only way I'm going to look at it, because
Mhm.
I can't, words have power, right?
They
So
do.
we can speak that onto ourselves, or we can just speak it as we see it, and then go ahead and proceed as we see fit. So I was like, not gonna own this. I was not gonna let it be something that I was gonna succumb to for certain. So I said, well, I'm gonna say it this way,
Yeah.
and kind of handle it like that. um and saying that words have power, that's also so, I'm raised in church, so
Mhm. Mhm.
the power of death and life are in the tongue.
Yes.
And we know these scriptures, and that kind of thing. And that's another part of this conversation too, is for those of us who are church kids, I call ourselves,
Yeah.
but
Yeah.
raised in
Mhm.
church, man. Jesus gonna fix it and all that kind of stuff. Therapy is not high on the list of folks raised in church. As a matter of fact, I'm having a situation now in my family where I can't get, and I'll be very frank with you, I cannot get my mother
Yeah.
to even understand the importance of therapy and counseling, even for her. My mom just turned 80,
Mhm.
and she said, well, I've been doing this my whole life. And I'm like, yeah, but it doesn't mean that you have to do it for the rest of your life, which could be another 20 years or something. I mean, we don't know, 20, 30. We have no idea how many days we have. Why not live them to your best, right?
Yeah.
But yeah, can you speak to that though, that whole religious thing, that especially with us, especially with
Mhm.
black
Oh
folks,
yeah. Now even though people think I'm ungodly, like so my grandma's house,
yeah.
my grandmother's house right next to the church. So I couldn't avoid church growing up. So I think that education is important, because when you're dealing with Black clients, you got to get past the church stuff, the church stuff that blocks us but my understanding of the gospel is that, if you have spiritual understanding, you can have your milk and honey here. It doesn't have to be in the
Yeah,
afterlife. So part of your milk and honey experience, if you have faith, is to live your best life while you are here, right? So
absolutely.
what the stumbling block is that faith, prayer is one part of it, right? So we
Mhm.
always talk about faith without works is dead, but I look at it as a combo platter. You can have your faith, but you're going to need some counseling too, because what
Yes.
counseling does is give you a certain skill set. Faith, spiritual understanding, that's a skill set.
Mhm.
Learning to process your emotions, learning what coping strategies are, taking strength-based approach to deal with difficulty. That's a different language. So it's like learning a new skill set. But it's also how we advertise therapy. If therapy is advertised as an old bearded white man with glasses talking about objective introspection, are Black folks going to participate in that? So what I normally do, I meet people where they are. I might say, like, Sister Jenkins, you ever been get your hair done and you just start running your mouth, telling your business, you getting all the tea? Oh yeah, Dr. Garnes, I've done that. I said, do you have a friend? If you call them on the phone, you gonna live in power because they're gonna give you something. Like that conversation gonna feed you in some kind of way. She, oh yeah, I've done that. And I said, that's all therapy is, that same feeling. I said, don't you want access to some mental liberation to free your stuff? Oh, that sounds good. Therapy can give you that. So it's all about how we advertise therapy. So I'm always an
Mm.
advocate for the language and the advertisement of therapy can change. Because I don't care if you run with the devil or you praying for the Lord. We want a couple of things in life. Everyone wants to have their humanity affirmed in some way.
Mhm.
It's a human need to have our humanity affirmed. And secondly, whether we say this or not, everybody wants help.
Yes.
So if you know those two things about people, you can get past the stumbling blocks that faith presents. So I don't look at it as a choice. It's a combo platter. Your mental
Mm.
health combo platter is spiritual understanding, counseling, therapy, and other things. So you want to get this healing combo, it comes with different side dishes. But I would say, look
Yeah.
at it as a main course. So one of your main courses might be, faith, and then the other main course needs to be some therapy.
Got you. I love the combo plates.
You got to have that, like.
Absolutely. Absolutely. Um, and they're too kind of
Mhm.
in that same wheelhouse is this whole okay, so for men, man, this whole prostate cancer
Ooh.
thing can be very intimidating.
Mhm.
Just from the outset. Even before I had my diagnosis,
Yeah.
I was dealing with frequent urination and this urgency of urination, where you feel like you really got to go, and then you get there and nothing happens, and you're standing there for like 20 seconds, and then drips, and it's like, no, no, I really have to go. And but you have to stand there for like another 20 seconds before anything happens, and
Yeah.
I mean, it's very frustrating. Not to even speak of the erectile dysfunction part, man.
Mhm.
You're ready to have, your intercourse or whatever it is,
Yeah.
and nothing,
Mhm.
or you got it up, and right before it's time to do it, it goes down, and you
Oh,
can't
yeah.
do anything about it.
Mhm.
Um, and those were some of the early indicators for me.
Okay.
Um,
Something was wrong.
uh, and so I finally um, said, "Listen, I need to see a urologist." I'm, what you don't, like, we've talked about it in some of the previous episodes, so I'll try to like really encapsulate it. But
Yeah.
my dad went through a series of cancers, beginning with colon cancer,
Mhm.
and then he got rid of it. Then he had bladder cancer, like three
Mm.
or four different times. They finally got rid of it. Then it showed up in a kidney, and he had one kidney for years. My dad was an avid golfer, played golf like 3, 4 times a week. He was still playing. He was good. Um, But after this kidney situation, he was still living in California. My sister and I were living here in Atlanta.
Mhm.
And my dad says, "Hey, man, I think I want to be closer to y'all because this is getting kind of weird to me." So we moved him here, and then he in his medical program here, man, it was awesome. He had an oncologist who said, "I want to do a test on you because I want to find out something." So he did this genetic testing and found out that what my dad had was something called Lynch syndrome.
Mm.
Lynch syndrome is basically a defective gene that allows for all of these particular cancers. And when I
Mm.
say allows for, the way that they explain it is that every human body has cancer. Uh,
Mm.
every single human body has cancer, but the healthy human body response is to keep it at bay so it never materializes and you never even know, right? So, but this defective gene, I believe it's the MH2 gene. Don't get me the line. I think that's what it is. I've seen this chart enough, but
Mhm.
I what it does is it basically swings the door open and says, "Hey, right this way." And so even though they eradicated those other cancers from his body, this gene was opening the door and allowing for these other cancers to manifest, as it were. So excuse me, by 2012, early 2013, he developed this esophageal cancer.
Mm.
But because of all the other treatments and stuff that he had had along the way, the only thing that they could do was chemo. They couldn't do any surgery, they couldn't do anything. And the chemo at that point was basically just destroying him.
Mm.
And so we lost him in January 2014. But he kept telling me, "Kip, you got to take this test. You got to take the test because you got to know." Um, because knowing is is everything. Early
Mm.
detection, early treatment is everything, right? So I didn't take the test until 2020. I did test positive for
Mm.
it. And then I was having all these issues and I was just kind of like too scared to go and,
Mhm.
just all of that stuff. So I finally went to the urologist, and sure enough, my PSA was 20. Your PSA for the normal PSA, well, they've been telling us that the normal PSA for men is 4 or under.
Okay.
Mine was 20, which sent shockwaves immediately. They scheduled an MRI and a biopsy immediately. And then she said, "We'll test again in a couple of weeks. It could be something else making it high. We don't know." And in a couple of weeks, when we tested, it was 21. Um, so we knew what we had to do. We had a treatment plan, or we had a plan anyway of investigating to find out what was going on. And we went from there. But at that point, I I was ready. I think I just was ready to grab it by the reins and let's do what we got to do.
Mhm.
Most men, I'm finding out, and even in my support groups and all the other organizations that I'm dealing with, most men are very reluctant to deal with this whole situation, and especially black men.
Yeah.
um let's talk about that, right? I mean, how we're raised, I don't know. I mean,
Mhm. Oh yeah,
those things.
it's culturally based in the sense that in black men, I mean, think about every black show coming up had an episode where they don't want to go to the doctor. Like that's a constant theme running through the black community. Like, oh, let's get Fred to the doctor, you know.
Yeah.
So it's cultural, but also how masculinity is constructed, especially here in America, you can't show weakness. So vulnerability or anything that makes you vulnerable is frowned upon, right?
Hmm.
So
Hmm.
when you look at diagnosis, when you look at mental health, trying to get men to be vulnerable is almost like a curse word. It's like, uh you should see how men come to therapy with me kicking and screaming, but they leave saying hallelujah. But what
Mm.
I do is just provide a space, and not even a safe space, but a brave space that
Mm.
pulls out of their authenticity. every man wants to share their story. Every man wants help. Every man has vulnerabilities and insecurities that they want to explore. If you find a way to invite them to explore that, that's not only how you get good mental health out of Black men, but it also breaks down the walls to go to church, go to the doctor. But how we have conceptualized masculinity, it does not have a lot of elasticity. So, we get these ultra masculine visions, absent emotional processing. Our emotional expression is frowned upon, being vulnerable. So we basically put up a front, and this front is killing us because it's not allowing us to get the help that we need. So vulnerability has to be linked with strength. And what we have to do to support brothers when they are vulnerable, we have to embrace that. So there was a basketball player, forgot his name, that they asked him a question and he broke down crying. So, I'm a therapist, so I'm going to the comments like, how are they gonna deal with this expression of masculinity that is a little more vulnerable? Clowned him. Do you think that this brother is going to ever show publicly any emotions or even in his private life? So when Black men are vulnerable, we need to support that. We need to empower that, because a lot of times the vulnerability of Black men is often attacked. We've made to pay some kind of price for being vulnerable, but also the limited emotional display rules for Black men, it has roots in how we were raised. Like, we had to be strong at a certain point. We could not show weakness at certain
Right.
points in our history. But now that we are free, let's get all the way free. Okay.
Yeah. I think that was Michael Beasley, and I remember that clip that you're talking about. My first reaction was, like you said, where's he going to get the help?
Yeah.
My first reaction was, oh my God, I hope he doesn't hurt himself. I
Yeah,
mean,
that was
it
my other
was,
reaction, because I'm trained in I've got specialized training in suicide. I thought the same thing. Like, I hope we don't find him somewhere. Yeah, I agree.
yeah, it scared me. And I shouldn't have been scared. I think I should have been happy to see this act of vulnerability from this
Yeah.
young Black man, but I was frightened beyond belief. I was just like, and the guys he was talking, it was maybe Steven Jackson and his co-host.
Was it
I,
Matt Barnes?
I
Matt
don't
Barnes.
think it was. I don't
Okay.
think it was Matt Barnes. It's his name's escaping me right now.
Mhm.
But they're not mental health professionals by any stretch of the
Yeah,
imagination.
yeah, yeah.
Matter of fact, we could all use help in that line. But
Yeah.
and
Hey,
I'm not trying to
I got a
bash him, but
therapist. I got a therapist, so we call you.
perhaps my therapist has a therapist.
Yeah.
Yes, yeah, absolutely. So I mean, I just to your point, man, I felt like that was a moment, a teachable moment.
Mhm.
Um, and there were no teachers on deck.
Yeah,
Um,
I mean, we missed several mental health moments. I don't know if you've been perusing Facebook today, but I just shared something that happened to me where I was asked to speak at a Black mental health event, right? And then
mhm,
the invitation was unceremoniously snatched from me because they wanted a celebrity, and admitted that the celebrity had no mental health experience, but asked, could I train this person to basically perform at this event like they knew something about mental health. But that's how trivialized we look at
mm,
mental health in our community. Like, it is not a distinct skill set, like it is not an expertise. And so when we have these conversations, the reason why we can't when somebody like brother Beasley emotes in this way, the reason why we can't go anywhere deeper with the conversation is because we're absent the language, our training to even understand what is going on. So, there are layers
mm,
and nuance to mental health that's missed. Like, mental health is the new Black. Like, especially here in Atlanta, I'm seeing all these panels. I don't see any trained mental health professional. So when we look at mental health, we have to see it as a distinct skill. We have to see it as people being trained in the Black experience and being trained in the ways of healing. Healing is a skill set. I think everyone has the potential to heal, but you need a conductor. You know what I'm saying? Like, even the
yeah.
greatest orchestras have a conductor. So look at therapists as conductors for your emotional well-being.
Wow. That's I couldn't have said that any better if I knew how to say it. That was, yeah. I mean, I totally get it. There, the dismissal of, like you said, the skill set of your training,
Yeah.
just to have, someone's name value attached to something. I mean, that's actually dangerous. If you would,
Yeah, so I give you an example. So when I'm hearing someone talk, I can hear, okay, when someone says, I used to be interested in poker, I don't play spades no more. I'm like, lack of interest in things that you used to like. That sounds like a depressive symptoms. And sometimes, I'm always worried about bills. I got my girl, I got my family, I'm trying to make it. Excessive worry. That's anxiety. So we miss that when we're not trained to notice what people are saying. Or
mm-hmm.
someone says, I had an out of body experience and I'm starting to see things at work. And it's a person that follows me and talks to me. I'm like, schizophrenia, maybe something like that. So, there
Mm-hmm.
this is training that we go
Yes.
through to recognize these things. But I think what makes me effective, I love and care about Black people. So that's what supersedes anything that I do. So because I have a love for Black people, it's going to show in whatever I do. And so I think that how I get people into to buy into therapy is I think they know I have an affinity for them as a Black person. And so that affinity normally allows me to knock down walls. And when people look up, an hour has passed and they done shared everything in the world with me. But I
Mm-hmm.
just try to focus on being authentic. And everybody wants to tell their story. I just need to know a little bit about a person. I can get them to tell their story. And once
Sure.
you tell your story, that's when the healing begins. Because we look at with mental health, what we miss in the Black community, we focus on behavioral change without a consciousness change. So you're not going to get to
Mm-hmm.
behavioral change unless the consciousness changes, right? So
Yes.
when you
Yes.
change a person's consciousness, you allow for different emotional development, and then you allow for behaviors to follow that emotional development. So we have to focus on consciousness raising. So when
Mm-hmm.
you look at change, awareness is the first step. You can't change anything until you develop an awareness about how all of the dots connect. So if anything that we do in therapy as Black therapists, we are raising consciousness of Black people and making them aware of connecting the dots in their life.
That really speaks speaks to the importance of the cultural association. I know when I was looking for a therapist, I didn't want some, you know, I didn't want some white woman. I
You
didn't
can,
want
you
I
can
didn't
hey, tell the truth, ain't the devil. It's your show.
it is. Yes, it is. So I didn't want, I didn't want anybody who was culturally unfamiliar with me.
Yeah,
I
yeah,
didn't want some hetero normative person who would not understand my sexuality. I didn't want, I mean, there was just specifics that I just had to have. I speak to that because I think that
yeah.
is,
So I the genius that is Dr. Ed Garnes had a father. And so my psychological father was Dr. Joe White. He's considered the godfather of Black psychology, who helped develop the discipline of Black psychology. So he wrote this essay in essence that kind of opened the door for the discipline of Black psychology. So being trained by Dr. White and understanding that we have these innate psychological strengths. I named some of them earlier: resiliency, improvisation, connectedness to others. Spirituality is a psychological strength. A gallows sense of humor. That's Richard Pryor, Dave Chappelle,
mhm,
Chris Rock. A gallows sense of humor. Laughing to keep from crying. That's what gallows sense of humor
mm,
means.
mhm,
Brother Langston Hughes had a whole composition laughing to keep from crying.
yes.
So when you think about I was raised by the godfather of Black psychology. So I have the cultural underpinnings because what fails us as Black people is thinking that any system cares about our mental health. There is no system that is going to promote the mental health of Black people, because once you liberate Black people and they're mentally free, You know, no system oppressing you wants you to be mentally free and have it together.
Mm.
So you have to, as a Black therapist, you have to have specialized training, because unfortunately in the psych world, you can have a PhD and be culturally incompetent because a lot of the curriculums do not focus on Black people. It is a white normative standard. So a lot of my training came from, working under Dr. White and a lot of the Black psychologists, Dr. Asa Hilliard,
Mm.
studying his work, out of Georgia State, came from Cali, came down to Georgia State. I think about Adesai Ajumu, and, just different people like Dr. Eric Bridges. So other Black psychologists in the game put me up on game. And so I try to use my life experience, my education, and then just sitting at the foot of the godfather of Black psychology to have cultural competence. And so, what does that look like in a therapy room? So I can hear that someone wants to talk before they even know. Well, I don't know this therapy thing, but you got something to say. Sister,
Yeah,
what's on
yeah,
your heart today? Who you want to say? You know what I'm saying? So when
yeah,
I'm
yeah.
doing an assessment for anxiety, I might switch up the questions. It might sound boring, and then I throw in the question, and you wanted to smack somebody what day of the week. So that allows people to say, oh, okay, this therapy thing is all right. This man is human just like me. So that cultural competence piece is important. And so I tell people, get a Black therapist, but I've had to add this recently since, I've gotten my PhD. What I realized out in the world, get a Black therapist that loves and has concern for Black people. So I have to
Mm-hmm.
add something extra. Get a Black therapist. Make sure they love and support Black people.
Preach. Yeah,
Because
yeah.
the discipline of psychology is so whitewashed. If they don't have a love and appreciation for Black people, they're not going to have the cultural competence to help you.
Mm. Yeah, you don't want the Byron Donalds of psychology working with Black folks. Yeah,
Mm-mm,
I get
mm-mm.
it. I
And so if
totally
I
get
was working with you, I'm taking a strength-based approach. So I'm gonna say, Kipper, I know that this diagnosis it done put you on your tail. But what I do know about you, you got some strengths, you got some resiliency, you done overcome some things. So,
it. Yeah.
so how can we pull that resiliency and those strengths that you already have? We just gonna apply, slide it over to a new situation.
Before we dive back into Kipper's conversation with Dr. Ed Garnes about the mental side of healing, here's a quick check in Kipper recorded on day 6 after his prostate surgery. It's a candid update on pain, mobility, and mindset that helps frame today's discussion.
Hey, what's up, y'all? It's Thursday, July something. I think it's the 15th. So day 6 after the surgery. All is going well. Excuse the congestion. I just sneezed. Don't sneeze. It hurts like hell. Oh my God. Day 6. I switched to my leg bag today because I want to try to go outside and actually go like maybe for a walk or something. The girls are coming by, so had to take a shower, try to make myself presentable. And yeah, pain levels really low. I'm not using tramadol with that old nightmarish foolishness. But thank you all. And I'll see you on tomorrow, day 7.
And now, back to Kipper and Dr. Garnes.
That was kind of taking me to my next point,
Mhm.
because anxiety,
Okay.
depression,
Yeah.
those things, they just start to manifest
Uh-huh.
along the way. I know when I had surgery, but they said the surgery was going to be my best option.
Uh-huh.
If in fact the cancer was localized strictly to my prostate, that surgery was going to be my best option, then I may have to do some radiation down the road.
Okay.
Because what they do is they remove your prostate, and then they try to get all of the surrounding lymph nodes that are attached. You
Okay.
can't get all of them, but you can get the ones that are make themselves available.
Okay.
Um, which means that if the ones that are still there are still harboring some of the cancer cells, then we'll have to do some radiation, because that'll be the only way to eradicate it at that point. So yeah, I ended up having to do 7 weeks of radiation.
Ooh.
Hearing that just kind of let the air out of my balloon, because I'm thinking, okay, we got the surgery, I'm gonna be good.
Yeah.
I'll just heal from this and we'll move on. And then as we monitored my PSA, it was like 0.13, and then it was 0.27, and then it was 0.56. It's trending in the wrong direction. So we had to do the radiation to get it where they want to call undetectable, 0.01, basically, right? And doing the treatment itself is nothing. You have to show up every day, drink a whole bottle of water before you get on the radiation table for 7 minutes while this thing does this, goes around you. Nothing ever touches you or anything like that. But it's paired with hormone therapy, because prostate cancer feeds off of testosterone. So while they're treating you for doing the radiation treatment, they have to eradicate all the testosterone from your system. And for any man, any adult male, any adult person with a prostate, that is your energy, that's your libido, that's your temperament. It's all of those things that make a male person a male person. And so to have that taken away from you is, I mean, listen, I'm having all the things that a middle-aged woman would have. I'm having hot flashes. My nice big chest just turned to boobs. It's all of these things. So I mean, that really starts to tweak your mental at that point, right? So tips for dealing with that anxiety, that the potential depression, and all of those things become invited into your cipher.
So the cipher of medical trauma. How do you freestyle your way and improvise out of it? Okay, that's what I'm gonna tell you how to do. Get out this cipher of medical trauma. So one of the things that I spend a lot of time with patients, especially when, and it's funny, Kipper, I have about 5 or 6 patients that are their issue is coping with cancer. So this is something I'm getting educated on. And I don't know if I shared this with you. My father passed of cancer. So like, this is something that I take very serious, right?
Yes.
So it's this principle in psychology of locus of control. My grandma used to always say, does it help you make a turd? And that was her way of saying, if it doesn't do that, it ain't nothing to worry about. So in the counseling world, locus of control is very important in helping with depression and anxiety. And essentially, if you have an internal locus of control, meaning I, as Kipper Jones, believe that I can get over this. I believe that I can put things in place to help with my resilience, to help with my coping. If you internalize and believe that, then that internal locus of control is going to drive you in those moments that you do not have control of a circumstance. If you have internal locus of control, you know that the one thing that you have control over is how you respond to life circumstance. What ends up happening when you're dealing with something like medical trauma, that's an external thing. So we give that external thing power. And so what ends up happening, we surrender everything to what we're dealing with. So the cancer is the externalized thing that we focus on and say we are powerless against. And so when you have an external locus of control, you have closed the door on any other mental health possibilities but depression, anxiety, and these other things. Well, the internal locus of control are this belief that you can control at least your response to life circumstances. Then it empowers you in a way that when you confront circumstances that you cannot control, you're able to deal with it. So I told one Black person, look at the cancer journey as like being Black in America. We have learned certain rules of engagement our skin ain't changing, right? So in our lives, we have learned to adapt and know that's something I can't change. I have to work around it and find other mental possibilities. So when you're dealing with a threatening illness, you have to know you can't let it control you, but you can kind of control your response. And so how you do that is being honest with how you feel. When you're dealing with what you're dealing with, you're going to have mixed emotions. Resentment is a cousin of anger. So you're going to deal with resentment. You're going to deal with self-loathing. You're going to deal with hopelessness. But you allow yourself to go on that journey, because what the journey is going to teach you is new coping strategies in order to heal. But when you have strengths like you have, the reason I think you've been able to get with this and really attack it, even your psychological reframe that the prostate has cancer, not me, that's a psychological strategy. So when you take a strength-based approach and you lean into resiliency and you control your controllables, then nothing can have dominion over you.
Yeah, I think that has been if I can say, that's been my saving grace, is just the framing of it all.
Mhm.
I don't buy into, well, this is what they did, so I guess this is what I have to do. No, I can see it through my own lens, and if I create that lens and say, I don't own this, this is a thing. It is happening to a part of my body, and I will have to deal with it, but it doesn't own me, and I don't have to buy into that. So thank you for saying that. I didn't,
Yeah. And
I didn't have language for it, but
yeah,
you know,
you had some built-in strengths and resiliency that you pulled from. I had my own near-death experience where I was on a breathing machine. I mean, I was about to get up out of here. And
mm,
what ended up happening is something happened over a 24-hour period that doctors could not explain. And so when I finally came out of it and the doctors came to me, they said, you know what? Your fight is what made us fight to help you. And I said,
mm,
what do you mean? They was like, well, you weren't really conscious. You was coming in and out, but they were like, you were always laughing. You was always pleasant with the nurses. You always had a good attitude. And so we said, he is probably going to come out of this just because of where his mental disposition is. So
mhm.
there's no physical or biological explanation on how I made it out of the hospital beyond resiliency, some psychological strategies that are deeply embedded in me that got me through that. So that's
Yeah.
the power, of resiliency and having some internal locus of control to control the thing, control your controllables is what they mean.
My primary care doctor, Dr. Victor Blake, says that your outlook is probably the largest part of your immune system. uh right, so I mean, that's where we get our fight, that's where we get
Mhm, mhm.
our whole get down. So I guess that's what you're saying, too, is how you look at it um will dictate how you come out of it, right, or how you go through it anyway. Yeah.
Yeah, and therapists, we help people with hope maintenance, right?
Mm,
So you have to allow for the mixed emotions. You have to process, you have to talk about it, you have to get that out of your system so you can get to a brighter day. So part of therapy when you're having, illnesses and things that you can't control is really just being your authentic self and being honest about what you have the capacity for. So some of my patients, I say, don't look at battles as I fight every day. Sometimes the most important psychological question we can ask ourselves at any moment, what do I have the capacity for today? And
mm.
only do what you have the
What you can do.
capacity for within that time.
Yes, sir. Yes, sir. um Man, in the time we have left, Ed, a lot of people, like you said, therapy is the new black. So I mean,
Yeah.
everybody's talking about therapy. It's the new conversation to have. Um, but the people that aren't having it may not know even how to access it.
Mhm.
And I think that is a large part of this conversation as well. Um, for one of the organizations that we work with, Zero Prostate Cancer,
Mhm.
is trying to make these things available. Again, not necessarily on a good cultural basis.
Yeah, yeah.
So
The culture.
how,
Yeah.
and one thing I mentioned earlier, like about how we're being tested as black men or
Hmm.
black people with prostate. I'm getting my language together,
Hmm.
um, because in the LGBTQ space, I want to be able to people to identify how they feel like they need to identify.
Hmm. Yeah.
So if you have a prostate and you are over 30, I think it's time to get tested when they're telling everybody else, oh, 40 is a good time to start getting tested. I've had three three people in my support atmosphere over the last 2 months who are under 40 who
Mm.
have dealt with prostate cancer.
Okay.
So for us, I'm saying 30 is a great time to start getting tested.
Okay.
And then they tell us that, 4 or under is where your PSA level should be. We're saying in our atmosphere, 2 or under.
Okay.
If your PSA is above 2, you should be getting screened, and we should know about it. And a PSA test is a blood test. It's a simple blood test.
Okay.
Um, they're finding that is more articulate than the rectal digital exam, which is a short swipe. But for the heteronormative man, ain't nobody sticking their fingers up. Okay, great. We'll do the blood test, and that's going to teach us more anyway.
Okay.
Um, but all of that just to say, we can access the PSA testing, but
Mm.
how can we access culturally appropriate therapy?
Well, I
How?
think, I think one good resource is the Association of Black Psychologists. They normally have a guide, or they normally have a state guide of, and can point you in a direction to find a therapist. So the Association of Black Psychologists will be one. I
Mhm,
encourage you to follow one of my mentors. I've sat at the feet of some great trainers. Another
mhm,
great mental health resource, Dr. Alfie Breland, who goes by Dr. Alfie.
mhm,
Following her, she has a lot of resources, not only for adults but Black teens. No matter how you identify, she has resources on her website. Um,
mhm.
Also, Psychology Today is a good website, but I tell people, if you're looking at a profile for a therapist and they don't mention your identity anywhere in their profile, that's not the therapist for you, right? So you want to look for things like, I can deal with LGBTQIA issues, if people that are very attuned to culture list that and present themselves as that. They don't just say, I deal with depression, anxiety, I deal with identity issues, racialized stress, work-related stress. You know what I'm saying? You want to look
Yes.
at their profile, and if they explicitly name cultural competency as one of their strengths, I think you can rest assured that they have that competency. So you definitely want to look at a person's profile and background. Let Google be your friend.
Mhm,
A lot of people find me through things that they have seen. Like I'm part of an organization, CNP, that works to support and change the narrative for Black career men. A lot of Black career brothers have found me because they
yes.
seen me on the website. You see what I'm
Yeah.
saying?
Yeah.
So,
Yeah.
so do your research. They say Dr. Johnson is culturally competent. Google him; it'll show up.
Mhm.
And you want somebody that has specialized training. Some therapists even will allow you to do like an interview or like getting to know you session that they don't charge you for, so you can see if it is a good fit. So you want to ask a therapist, do they offer that? And then that can tell you whether you jive with that person or not. But ask specific questions. So I give you a specific questions. What experience do you have working with Black queer men that are unsure in their identity? If they smirk at a question like that, then you don't need to be with them. If you say,
Sure.
yes, I am an upperly mobile Black man that's dealing with racism in corporate America for the first time. You have any experience with that? If they start fumbling, that ain't the therapist for you. Because
Yeah.
any therapist that is a fit for you should be able to articulate and speak to your issues to a level of comfort that you feel safe talking to them.
Man, that's that's it in a nutshell. I
And
am.
also, if you're interested in the wonderful Dr. Garnes, you can go to dredgarnes.com and go to my booking page if you would like some time.
Absolutely.
Because
Absolutely.
I'm also available.
That is not a shameless plug, y'all. That is
Uh,
that is it in a
but to
nutshell.
show
Good
you
brother.
how people are coming to therapy, I have seen close to in less than a year, I have seen almost 800 people. I have had almost 800 sessions. So that tells you that we're coming back to therapy.
That's a good thing. I thank you, brother. I
Oh
don't
no,
even
I love it. You know, whenever I can run my mouth, my grandma used to say, "Boy, you get paid to run your mouth, you be rich." So,
Well, guess what, Grandma? They paying him now.
they paying me now by the hour. But no, I mean,
Awesome,
I
man.
appreciate it, man. Like when you reached out, I was excited because I've been wanting to find a space where we could have some kind of conversation like this anyway. So,
Yeah.
I'm available as a resource. I have a lot of respect for you. And you are a big brother, uncle, and everything in my life. So, part of it is feeding into you as well.
Man, I appreciate that. And this is not going to be the last time, that's for sure.
Good,
I
good.
absolutely know that. Brother Ed Garnes, thank you, man. Thank
Mhm.
you. Is there anything else you want to leave us with? Because you got nuggets, and I
All
want
right,
I
so I'm gonna
you know
leave you. I'm gonna leave you with something that I told a young couple I was working with today. Sometimes in life, you got to put your dreams on water to see if they will float. So for
mm,
every Black person, put your dreams on water to see if they will float. That's my message to us today.
today. Good brother, man. I love you. I appreciate you,
Love you
man.
too, man.
And I know that we will be talking soon.
Oh yes, oh yes.
I thank you for mentioning CMP because that organization is very near and dear to both of
Yeah, I
us.
got on. I got on my Bayward involvement.
I couldn't wear that and Cyrus's
Oh
artwork
yeah, yeah.
at the
But we
same time.
supporting Black. So this goes to show you, it's not just a word. You see,
Yeah.
we support.
No, this is word in action, people.
Yeah.
So Ed, thank you so very much, good brother. God
Welcome,
bless you,
brother.
man, and thank you.
Always a good time.
Thanks for tuning in to this episode of Spirit and Truth. You can subscribe to the show wherever you listen to your podcasts and follow Kipper at Uncle Kipper everywhere on social media.